Greetings, everyone. Welcome to Madness. Let's discuss the difference between diabetes mellitus and diabetes insipidus. These terms are always confused with each other. Before we dig in, let's see what their literal meanings are. What diabetes is derived from the Greek word meaning siphon, which means to pass through, indicating loss of water in the form of urine. While mellitus is a Latin word which means sweet. The reason behind this word is that excess sugar is found in major body fluids such as blood and urine. It is informally called sugar or sugar diabetes. The word insipidus is a Latin word. In means not and sapidus means tasty. In short, it means lacking taste or tasteless. It is commonly called water diabetes. Diabetes mellitus is linked with pancreas. But how? Pancreas has islets of Langerhans which possess multiple cells such as alpha cells and beta cells. Here, our concern is beta cells which produce insulin. In diabetes, there is insufficient insulin production or insensitivity of cells towards insulin. Basically, insulin helps glucose entrance from bloodstream into the cells. Cells utilize these glucose molecules for energy production by glycolysis. When the body faces insulin deficiency, glucose molecules pool up in the blood vessels, causing hyperglycemia. Now, let's see what's happening in diabetes insipidus. Hypothalamus is a part of brain which produces vasopressin, also known as antidiuretic hormone. Hormones are the chemicals which travel in bloodstream to reach different organs. Vasopressin is released from hypothalamus and acts on kidneys to regulate water balance. If body faces ADH or vasopressin deficiency, body urination increases, causing polyuria and ultimately water imbalance. Unlike diabetes mellitus, it is not linked with sugar control problems. Now, let's hover over symptoms of diabetes mellitus, which are increased thirst, frequent urination, unexplained weight loss, fatigue, blurred vision, slow wound healing, and recurring infections. On the other hand, prominent symptoms of diabetes insipidus include extreme thirst, excessive urine output, dehydration, and electrolyte imbalance. Let's grab details on both types of diabetes. Diabetes mellitus is mainly of three types. In type 1, beta cells of pancreas, which produce insulin, are attacked by body's own immune system. We can say it becomes an autoimmune situation. In type 2 diabetes, there is insulin, but the body refuses to respond to insulin, which means insulin resistance has been developed. The third one is gestational diabetes. Gestation means pregnancy, and gestational diabetes occur when placenta introduces hormone which interfere with insulin function or may cause insulin resistance, leading to elevated blood sugar. It usually vanishes after pregnancy, but precaution is necessary as gestational diabetic women are at higher risk of developing type 2 diabetes later in their life. Diabetes insipidus has four types. The first one is central diabetes insipidus. Central term indicates CNS or central nervous system. ADH or vasopressin is produced by the hypothalamus, which is then stored and released by pituitary gland. If any of these are damaged, it causes ADH deficiency. The second type is nephrogenic diabetes insipidus. Nephrogenic means related to kidney. In this case, enough ADH is present, but kidneys don't respond to ADH, and hence water is expelled out of body in the form of urine. The third type is dipsogenic diabetes insipidus. Dipsogenic means something which induces thirst. Here in this type, hypothalamus gets disturbed and makes you feel thirsty. As a result, a person will drink plenty of water and urinate more. It might be due to mental illness or some brain dysfunction. It has nothing to do with ADH production. The fourth type is gestational diabetes insipidus, which is temporary and rare and only appears during pregnancy. In this case, placenta produces excessive vasopressinase enzyme, which breaks down vasopressin or ADH and causes polydipsia or increased thirst. It is not linked with elevated sugar levels. Now, heading towards treatment strategies. In case of diabetes mellitus, treatment revolves around blood sugar management depending on type of disease. It can be managed through proper diet, exercise, injectables such as insulin therapy, and oral anti-diabetic medications to overcome insulin resistance. In diabetes insipidus, underlying cause is addressed for cure. ADH replacement therapy is recommended in central diabetes insipidus, while nephrogenic type requires proper fluid intake and medications to overcome ADH resistance by kidneys. Other types also need adequate fluid intake to maintain water and electrolyte balance to protect body from dehydration. I hope you guys will find this video informative and interesting. Don't forget to like, subscribe and share. Thank you.